Hello, I'm Dr. Maria Sulindro, integrative anti-aging medicine practicing in Pasadena, California. Today, I'm going to share with you a topic of PCOS, which is the abbreviation of Polycystic Ovarian Syndrome, and infertility. I will tell you a little bit about my story before I share a diagram with you. Okay, but before we do that, I'd like to thank everyone who has subscribed to my channel and also give the like and share with your friends, because the goal of my giving the education is for community awareness. And PCOS is not very rare, but the problem is many women do not realize they have PCOS. Now, what is PCOS or PCOS? Sometimes they call it PCOS. It is easier, isn't it? Was first described in 1935 by Stein and Leventhal. And this is a syndrome. Now, you know, the syndrome is a compilation of certain symptoms. Not necessarily you have to have all symptoms, but this syndrome or symptoms are found in a PCOS diagnosis. So the first is amenorrhea. I'm going to explain to you what that one is. The second is hirsutism. The third one is obesity. The fourth one is the diverse disorder characterized by androgen hormone production by the ovaries itself. Now, it sounds like this is like a women problem now. The month of May, I'm going to discuss everything in a OBGYN fashion. Now, the first symptom is amenorrhea. What is amenorrhea? Amenorrhea is when menstruation is absent during the reproductive years. So that is between puberty and menopause. You can still have children, or it's called reproductive years. And it is not a disease. And it does not mean that a person that has amenorrhea is infertile, but it can be a sign of a health problems and needs some attention. Now, the second one is hirsutism. Hirsutism is a condition in women that results in excessive growth of dark or coarse hair in a male-like pattern. For example, in the face, they have a lot more in the mustache area, but they're women. And then in the chest, in the back. So with hirsutism, extra hair growth often arises from excess of male hormone, which is the androgen, which primarily testosterone. The third symptoms is obesity. Now, it is a complex disease involving an excessive amount of body's fat. Obesity is not just a cosmetic concern. It is a medical problem that increases your risk of other diseases and health problems such as heart disease, diabetes type 2, high blood pressure, and certain cancers associated with enlarged polycystic ovarian problems. In the last one is the diverse or heterogeneous disorder characterized by, again, androgen or male hormone production by the ovaries that interferes with reproductive, endocrine, and metabolic dysfunction, which commonly we call it as infertility. People cannot conceive. Now, from Johns Hopkins newsletter, I found out that when we try to look for the cause of PCOS, the exact cause of PCOS is not clear. Many women with PCOS or PCOS have insulin resistant Now we heard more and more about insulin resistance. This means the body cannot use insulin well. So insulin levels build up and in the body and may cause a higher androgen levels or a higher male hormone levels. Obesity can also increase insulin levels and make the PCOS symptoms worse. PCOS may also run in the families. It is common for sisters or a mother and a daughter to have PCOS. And I'm going to share with you my story. Therefore, after this, so there are 4 types of PCOS. One is insulin resistant PCOS. This is the most common one. Number 2, pill-induced PCOS. The pill-induced PCOS, it gets developed due to the birth control pills. Young people, they take birth control pills, and this can suppress the ovulations. For most of the women, these effects do not last long, and when they resume ovulation after effect of the pill is over, then it will become normal again. But some people do not become normal, but then they develop PCOS or Polycystic Ovary Syndrome. The third one is inflammatory PCOS. It's a chronic low inflammation. It's chronic grade, okay? A dietary trigger. This is such as taking a lot of sugar or glucose. So in an inflammatory response of the mononuclear cells in the women with PCOS. And this phenomenon is independent of obesity. They may not be big or obese, but they do have PCOS. It's called lean PCOS. And the last one is hidden cause of PCOS. You never guessed, okay? Because this is from thyroid disease, deficiency of iodine, ovaries needs iodine, and vegetarian diet, it makes your zinc deficient, and the ovary needs zinc. And from artificial sweeteners like Splenda, Sweet and Low, FDA approved these, and it's sucralose, saccharin, acesulfame, aspartame, neotame. All of those are very dangerous. In fact, if you read people who develop Parkinson and Alzheimer's, they have been taking all these sweeteners that are not natural. So if you're talking about these kind of sweeteners, it's better to get the sweet from the fruits, like a monk fruits or, apple, orange juice. Those are sugar also. It's not good to have too much, but it's better if you have to choose between the sweeteners that are non-organic or non-natural. Now, how to diagnose PCOS? This is ultrasound. Okay, this test is they use sound wave and to look through the computer to create image of the blood vessels and the tissues and the organs. This test is used to look at the size of the ovaries and to see if there are cysts or in the ovaries. The test can also look at the thickness of the lining of the uterus. It's called endometrium. We can also do a blood test, and this look for a high level of androgen, which is testosterone, and another hormone like SHBG, sex hormone binding globulin, estrogen, DHEA sulfate. DHEA is dihydroepiandrosterone. This one is the precursor of testosterone. Or you can check the blood glucose or level of insulin, level of leptin, which is the fat hormone. And you may have your cholesterol and triglyceride level also checked, and its fraction for inflammation markers. I'm going to tell you about my personal story. Then we'll look at the sharing of the picture. Okay. Now, let me see. I have difficulty sometimes with sharing, so I better try to do this first. One moment. How to share? No. Okay. For sharing, I think, one moment. Real quick. Oh, yes, I know now. Okay, participant or so share. Okay. I hope this one will take. Okay. And then I have to do the big one. Yeah. Okay. All right. I hope you can see. Now here you can see a picture that looks like a woman in pain, but it doesn't mean that way. PCOS can be painless. Okay. They have irregular period because they have amenorrhea. So sometimes they do not have ovulations. So when I was 27 or 28, that's my personal story, I thought that my face acne was normal, but I knew it was kind of like so late. Some people have acne when they were 14, 15, right? 16. I did have acne at that age, but then it continues all the way until 26, 27. And I start losing hair. And also, you know, I have my period every month, no problem, and no pain at all. And it's right on the clock, like every 28 days, or the most is 30 days. So one day, I was then I got married, and then we planned to have children, right? And then I got pregnant. But I lost my first child. It was 4 months old, and I had miscarriage. So my doctor said that, oh, I had polycystic ovarian disease. Okay. So, but at that time, I was already involved in integrative medicine. And I met this doctor, Dr. Abraham Gee, who told me that I have problem with magnesium and I have to stop drinking coffee because that really bind my magnesium and deplete it from the level. Also, I have problem with my estrogen and testosterone. So for normal women, testosterone usually is like 60, 75 the most, but I had 400. So that's when my doctor said, oh, you have acne because of that. But my integrative medicine doctor said, well, you have problem with your magnesium. That's the reason why you have problem with your hormone balancing. Okay. So he gave me plenty of magnesium. He checked my iodine, my thyroid, and then he said, oh, you're lacking of iodine, way too low. So I was taking iodine, and after like 6 months, okay, 6 months, my hair stopped thinning and my skin became smooth, and I was very happy. And I continued treatment, and again I went back to that was in 1983, by the way. So I went back to my OBGYN doctor, and then she checked on my polycystic ovarian disease, and it's gone. So I did not have the cyst anymore. So Dr. Abraham Gee, with his 17 publication in iodine and magnesium, and followed by many of his students, I was one. We believe that if you do not have enough magnesium, iodine, and zinc, you might be a risk of insulin resistant and also develop cysts everywhere, actually, not only in the ovarium. So luckily, I became pregnant again, and I had 3 healthy children. I was very paranoid when I became pregnant again. So I had each of them, I tested for amniocentesis, which is actually dangerous, right? Because I can lose my baby again. So anyway, that was my story. So today I'm going to tell you the management of how an integrative physician would manage PCOS. I'm not an OBGYN, I'm not an endocrinologist, but I do manage PCOS, okay? So this slide, it shows you the symptoms, the irregular periods, difficulties getting pregnant because of irregular ovulation, excessive hair growth or hirsutism, usually on the face, chest, back, or buttocks, okay? Then weight gain. I did not have weight gain. I'm quite lean, so they call me lean PCOS. Thinning hair and hair loss from the head. My hair was never here, okay? But I do have a thinning hair and oily skin. But even though I'm oily, now I don't have acne. I used to have a lot of acne. Okay, so this is the fallopian tube. So I'm going to get my laser pointer. Okay, this is this is your uterus, and then this is the fallopian tube, two, right and left. And on the left here, when I look, and it's on my left side here, the fallopian tube usually pick up the ovulation, and then they carry. And if you are planning to have a baby and getting pregnant, the sperm will meet the the ovum here, and then both of them will come up here and get implanted here, and then they grow over here. Now, this is the ovarium. So this is a developing eggs, and this is normal ovaries. And the other side here is what we describe as an abnormal one, where the ovarium has all kind of cysts. Look at all these cysts here. The ovum, the follicle will never get to the mature size, but then, and you develop all these cysts, and the ovarium can also become enlarged. So this is a bigger picture of the polycystic ovarium here, and this is the normal one, okay? Now, so normal ovary is here, and this is polycystic ovary. When you are diagnosed with ultrasound, this is ultrasound from the front, okay, from the body, in the front of the body, not from the vagina, but they also use the transducer vagina ultrasound. Now this is, you can see the PCOS ovary is like this. Normal ovary, you won't see the vacuole or the cyst. These are all the cysts. Now this is the transducer ultrasound. This is your rectum, this is your vagina. So they insert it here, and then this can pick up the ovarium picture, and then they will take a look at the ovarium picture here, and you can see there are so many cysts here. Now, okay, this is severe. Some have a few cysts, some have many cysts, but the cyst is not normal. Now, this is the acne that PCOS a person would actually suffer from. There are many of them. And this is the hirsutism. It's the hair in the face area, in the chest, in the body, and also on the neck, back of the neck area. So this is not normal for women. Look at this. This is the hair growth. So they have to shave, which, you know, this is because the testosterone is very high. Now, this is a little bit complicated for you to understand, but I would make it easier. So from the brain, this is the brain, this is the ovarium, and this is the uh, granular cells. So basically from the brain, we have the hypothalamus, and also it produced from the anterior pituitary gland. You have luteinizing hormone. The luteinizing hormone will also stimulate the production of the from the cholesterol, come down to pregnenolone, which is still the precursor, and become progesterone. And from the progesterone, you will get the testosterone. Now, for some reason, this is where we have a problem, because the aromatase actually create more testosterone than creating the estrogen itself. So this is from the body. So this is the same procedure, except here we can see the feature of the woman. And this is the brain, where the hypothalamus, the anterior pituitary gland, uh, can actually be also suppressed by the hyperinsulinemia. So the insulin goes up, and the insulin also reduce the sex hormone binding globulin, so the sex hormone cannot be bound by the protein, and then it can cause fatty liver, and also cause adrenal gland a problem here, increase the adrenal androgen production, which is the male hormone, and that one will create a problem in the ovarium. So this is the polycystic ovarium disease or syndrome. So basically, the clinical pictures of the PCOS is hypergonadandrogenism. So that's like all the acne and the hair and thinning of the hair. And then obesity. You can develop obesity because of the insulin resistant. And this one is endocrine dysfunction, right? From the one I just explained, from the brain, and it affects the ovarium function, and this is the hyperinsulinemia, and then it developed as an ovarium cyst. That's the abnormal ovarium. So what happens if PCOS is left untreated or unmanaged? Okay, so you can read with me here, right? The unmanaged PCOS can impact short and long-term health, of course. This is associated with type 2 diabetes, infertility, which is what the problem is. It's very emotional, because some people do not uh, get pregnant after so many years. It's very emotional. And the cardiovascular disease also can get involved because of the obesity. And then sleep apnea also disrupt breathing, right, in the sleep. Non-alcoholic fatty liver can develop, and also depression. Like I said, it's very emotional. Early diagnosis and treatment can help reduce this risk significantly. The problem with absence of iodine, remember I was given iodine, okay? I actually, there was a test, the test that was developed or created by Dr. Abraham Gee consists of 24 hours urine collection, and we have to be free of iodine for maybe 7 days. Do not eat anything like kelp or seaweeds during that time, because we are going to give you 50 milligram of iodine, and then you start collecting the urine from morning until the next morning, and then you measure in the urine container. There is a measurement, and then you get the sample, and then you send it to doctor's data. This is the lab that actually maybe exclusive right for this test. Now, it's not very expensive. I believe it's $50 for a pre, and then $30 for a post. So it's about $80 to find out if you are lacking of iodine or not. Because lacking of iodine, you can create a problem like cancer. And this involves breast, thyroid, prostate, salivary gland, skin, and stomach. So, and also creating a problem with low IQ. So people who are pregnant, they did a study. If they take 12.5 milligram of iodine during pregnancy, their children will have about 20 to 30 higher IQ than the parents. Now, this is a study. And also, if low in iodine, it causes stunning. So the children cannot grow cannot grow tall, sorry. This is why the ratio of women and men having a problem with goiter is 6-1, because women has estrogen and men do not. And the estrogen actually prevent an absorption of the iodine, okay? Absorption of the iodine in the cell. Story about Japan. Everyone is taking seaweed that contains at least average 13.5 milligram per day of iodine. Therefore, from that kind of story, then the study conclude that we can take at least 12.5 milligram capsules or tablets of iodine every day, including if you're pregnant. So this is very good for pregnancy. And they did a study, total iodine for the whole body is 1500 milligram per day. That's total what our body needs. Like I said, there are two different kinds of PCOS. One is lean, one is obese. So it's very difficult to figure out, because you suspect that the obese people that has a problem, but it's not. I was never obese, and it was difficult to diagnose, but luckily I don't have to undergo any surgery. Is it possible to have PCOS and be heavyweight or underweight? Well, we already talked about it. So lean PCOS or obese PCOS. So women with lean PCOS may struggle with irregular periods, blood sugar control, fertility problems, and other symptoms caused by elevation of androgen, which is testosterone. If you don't treat PCOS or PCOS, if you don't manage it, this can impact a long-term health associated with type 2 diabetes, infertility, we know this already by now, right? Cardiovascular disease, obesity, sleep apnea. Oh, I think we mentioned about this already. And next one. Now, with the integrative medicine, we always would like to check your diet, your nutrition, and then for the food to avoid if you have PCOS is refined carbohydrates such as mass produced pastries and white bread. Fried foods such as fast food, we know that is not good. Sugary beverage such as sodas and energy drink. Processed meat such as hot dog, sausage, and luncheon meats. Solid fats including margarine, shortening, and lard. So this is for PCOS. Now, what about the magnesium supplementation? Magnesium, there are many kinds of magnesium. I would suggest right now, since we have the bisglycinate magnesium, you take that one because it gets absorbed by the cell easier than other magnesium. And if you take magnesium, it improves and helps your insulin resistance and inflammation. Magnesium can calm you down and help you sleep better at night anyway. Now, there was a study by Asemi and friends indicates that women with PCOS can consume approximately 233 milligram per day of magnesium, which is below of the RDA. So don't follow that one. Don't follow RDA. What I suggest for my patient is take magnesium as your bowel tolerated. So if you take magnesium and you don't develop diarrhea, that you continue to add the magnesium, even though if it's already 6 capsules, 8 capsules, or 3 or 4 teaspoonful, continue taking more until you know the dosage of your magnesium per day. Then you continue doing that. That's what I did for almost the first year. I even had the IV magnesium, injectable magnesium in the butt, right and left every week. It was quite an ordeal, but we did it, meaning that we get rid of my PCOS, right? And we have to take also anti-inflammation to promote metabolism of the estrogen itself. And women aged more than 19 years old should at least average take 600 milligram of magnesium. Now, if you have diarrhea, you just take 100 milligram, then you have diarrhea, and you are already taking magnesium bisglycinate, then you should take care of your gastrointestinal first. Maybe you have a leaky gut or anything like that. I yet found maybe the most 2 patients that cannot take magnesium because they get diarrhea all the time. But if you can take magnesium, it's very good because it's not only for PCOS, it's for everything else in our body, including skin for anti-aging. So take home message. Okay. Now, take home message, always think about period that is abnormal. For an example, if the period is too long or too short, now too short means like a day, then no more. Or too long is like a week or 10 days. Some people think that 1 week is also normal, but 3 to 5 days is usually what a woman would have their period. And then unovulatory period, meaning that no ovulations. Some people can see like a broken grape come out during their period. That's an ovum. That's your egg. Now, if you don't have that one, and you have some problems with sugar, insulin craving, or acne, or hair thinning, you may want to tell the doctor who see you. You don't have to see OBGYN for this one. Integrative medicine, like me, I'm not an OBGYN. I know how to take care of this. So ask your doctor to check micronutrients like the zinc, magnesium, calcium, and iodine. Okay, they can check that one. Nowadays, technology is very good to check all these micronutrients according to your gene, personalizations. Iodine 24 hours, I have explained, and take the provocative iodine 50 milligrams, and take the supplement if necessary, and do not wait until you develop polycystic. And if you develop polycystic, I would encourage you to aggressively treat with magnesium, iodine, and zinc. Okay. Once you know you have polycystic ovarian disease, follow up until the cyst goes away. So this is the PCOS symptoms. Okay. Trouble conceiving, mood changes. They become very sometimes aggressive because high testosterone. I was very energetic, when in sport, in anything. I never felt tired when I do exercise. So this is the sign of too high of testosterone. Then I had acne, not anymore. So I felt fatigue after that, of course, and then insulin resistant, and then the high testosterone level, and then male pattern baldness, yes, irregular or missed period occasionally, some women do not have their period every month. Now, in my family, there are five girls. Each of us who have children, I have one sister do not have her own children, but all of us have our own children, but we lost our first pregnancy. Yeah. So in fact, I'm pretty sure we all are lean PCOS. And because I gain a lot of insight from this, so I have asked my sister to make sure that they take all these supplements also. Now, ovarian cyst, if it's removed, if you have too many problems, the OBGYN have a tendency to remove your ovarium. It's very, very emotional, I think. Yeah, unless you have enough children, otherwise they want to remove your ovarium, then you will not have children, right? So weight changes, trouble losing weight, and excessive body growth. So this is PCOS symptoms. Now, let me see. Yeah, so let me see, I go like this, and yeah, so let me check if there is any more questions. Let me see. Does a person who has had a hysterectomy, therefore no ovaries, need more zinc and iodine to maintain good health? The answer is yes. The reason is our thyroid hormone is produced actually by ovarium, right? Also thyroid. That's the reason why all these link. And if we are lacking of iodine, then the cancer provoked by this kind of situation can actually get the stomach, prostate, and the breast. You know, all these can link because this is a hormone induced, and the iodine helps the organ. And I hope that helps you. And then what is good starting dosage of iodine? 12.5 milligram. That is a study based on the Japanese taking kelp and seaweed daily average 13.5. So the tablets and capsules is made here. The minimum is 12.5 milligrams. Okay. And did you discuss salt, palmetto, metformin, and PCOS? Yes. So there is a medication, of course, prescription like metformin, okay, salt, palmetto. Those are very helpful. And it depends on the symptoms that you experience. So for example, if you have problem with your insulin, the metformin really helps. And I like metformin because nowadays, you know, there are so many good stuff come out from metformin. And saw palmetto is always helpful. Yes, thank you so much. Actually, I have a list of like berberine and all those of the micronutrients. But if you have a test, that micronutrient test, that should also give you an idea what kind of micronutrients you need for yourself. And also then we evaluate again the PCOS. Thank you for questions. Thank you for all those questions. I hope I cover everything. This one sometimes doesn't want to go to see, I cannot go to my YouTube here. So I hope I cover everything. Okay, thank you so much, and I'll see you next week. This month is we do have an OBGYN month, so I'll see you next week for another topic, which I think we will decide, but I have a feeling the topic is about menopause, hormone imbalance, and all those. Thank you so much. I'm Dr. Maria Sulindro, Integrative Anti-Aging Medicine in Pasadena, California.